Some COVID-19 survivors are noticing a surprising symptom months after their battle with the virus: hair loss. Our ABC 10 News anchor Derek Stahl is going in depth to explain how it's also affecting people who have never been infected.
The worst and most bothersome symptom I had was just that my eyes hurt.
Nikki Privet had a mild case of COVID-19 back in April, but several months later, she says her hair started falling out in chunks.
You know, girls, our hair always falls out in the shower. But I noticed that more and more was coming out in my hands. And then eventually in July, it became handfuls.
Actress Alyssa Milano posted a video demonstrating her hair loss on Twitter.
One brushing. This is my hair loss from COVID-19.
I definitely have seen more patients lately coming in for hair loss with and without having had COVID.
Dr. Nancy Molly is a physician in dermatology at Sharp Reese Staley.
From what we know about COVID, there's not really a compelling reason to believe that it's the virus itself specifically causing this, but more likely it's this stress-induced kind of hair loss that we know about and see all the time.
She says it's most likely a condition called Telogen effluvium, a type of hair loss that can affect both women and men and typically starts about 3 months after a stressful event. It can be triggered by emotional stress, like a job loss or a death of a loved one, or by physical stress, like a serious illness. Typically, we shed about 100 hairs a day, but Dr. Molly says when your body is in shock or fighting a disease, there can be a backlog on that hair loss.
During the stressful time, your body is prioritizing the most important functions, and shedding your hair is not one of them. So you end up having that delayed reaction where the hairs that were supposed to fall out during that time fall out later.
There's not a direct treatment for telogen effluvium, but it usually resolves itself after about 3 to 6 months. And while this kind of hair loss can happen after a COVID-19 illness, there's early research showing there may be a different kind of link between hair loss and the virus. 2 small studies showed that bald men may be up to 40% more at risk of developing a severe case of COVID-19. Scientists theorize it's because bald men have higher levels of a hormone called androgen that seems to help the virus enter cells. Derek Stahl, ABC 10 News.
And if you are experiencing hair loss that you're concerned about, doctors do suggest coming in for a checkup so they could rule out other potential causes. There are treatments for other kinds of hair loss.